Let's bring in my good friend. He's been part of this morning show for over 25 years with great insight into the world of sports medicine. You know, it's Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. What do you have for us today?
Hey, Ray. Good to talk to you today. Happy New Year. We're in this weather pattern now where we kind of hunker down. We're inside a lot. People watching a lot of sports on TV, watching a lot of football. Oh, my gosh, have you seen some of the ratings on some of these big games? And as football has kind of taken advantage of that by getting bigger and bigger games and expanding the playoffs and everything. And so in the last 3 months, we've been watching a lot of high school, college, pro football. And one interesting thing is I've watched with people, family, friends, and watched myself, is this instance of watching a little bit more closely of the kinds of hits that certain players take specifically in football. We see it, of course, in basketball and soccer and others too. But in football, as we watch on TV, and one of the things we'll see an athlete who gets a hit, whiplash, they'll land on their head. They're not always a direct blow to the head, and so there's always this, is it targeting? But many times it may not be targeting, but you can take a pretty bad blow to the head. And we've talked for years here that a lot of times that rotation or whiplash can be even worse to the head. And you watch the athlete. I do this. I don't know. It's kind of my orientation of what I do. I watch kind of the behavior of players after they take a hit like that. And I have to admit that it's so very hard to tell with these players quite a bit. Now, I'm going to say that there were a couple of very big games this fall in both college and pro where I saw games where I saw people get up. It's most obvious in a quarterback, but you can kind of watch their behavior pattern, especially if you've been around football for a while. Everybody's geared to it now. The quarterback may have like a faraway look confused or tentative for a while. It might be for a couple of plays or a series or a quarter in the game. And, people are keeping an eye on them. And so people ask me, hey, why are they not taking them immediately back to the blue tent or to the training room and evaluating these people for concussion? They don't seem to be playing at their best. They seem like that hit to the head may have affected them. There's the obvious ones, Ray, obviously, like the JOK hit, or the ones where there is people are loss of consciousness and clearly get into multiple symptoms of concussion with confusion and issues like that are no doubt about it. But a lot of these are very subtle. So I'm just going to tell you what you look to see. A lot of times initially the athletic trainer will be the first person who makes any contact. Maybe when they come back to the sidelines after a series or something like that, the trainer will ask a lot of questions. The trainers know their players the best, and they'll spend time. But many times the medical team will give these athletes a little bit of leeway. They don't go up right away and start evaluating them right away. And there's no doubt about it. There is where athletes are stunned or dazed for a period of time. And, oh, my gosh, people would be shaking in their boots to hear somebody like me say that. Oh, we've been trying to get concussion out of the game and everything. But there's no doubt that there can be transient, short-term periods where athletes are stunned or dazed a little bit. And if you immediately go back to the blue tent or the training room and you find some of these symptoms initially right off the bat, if you find concussion symptoms, you have to make the diagnosis of concussion. And one thing with concussion, it's an all or none. And if you make the diagnosis of concussion, that person's out for the rest of the game on the medical team. And so whereas we may evaluate somebody for a hamstring or a foot or an ankle, you see that all the time. And they're running on the sidelines and they're on the bike and they may get taped and they might get massage and then treatment in the training room and everything. There is no treatment for concussion. If they are evaluated and are seen to have signs of concussion, they are diagnosed and taken out of the game and ultimately usually put into the protocol. And so it's kind of strange that many times you'll see the medical team almost kind of giving distance and staying away from these athletes in the early stages just to see if it could be one of those transient issues. And it is, I'm telling you, from living it for a long time, 30-some years, it's one of the most anxiety-provoking problems for the medical team because you don't know when to pull the trigger on, hey, this person's just not acting right. I have to take them to the blue tent, to the training room. We have to evaluate this person. It may not be transient symptoms anymore. You know that a couple of years ago we did in the NFL and in college also have spotters up in the booth. But that they're looking for really obvious movement patterns of problem, and they call down and say, hey, you got to check this person. Number 52 needs to be checked or whatever. There are spotters, and that's going on without you on TV knowing about it. But when you are watching some of these guys this weekend, more playoffs, more games, you may see this. I'm telling you, in the last 3 or 4 weeks alone, I've seen this. I don't want to specifically say anything about any particular team because everybody feels like they're second-guessed and looking at it. But this has happened in some big games, and it's very difficult for the medical team. So know that they're doing their best, trying to sort through this, giving the benefit of the doubt. Could it be transient symptoms? Or is this somebody, hey, we got to check, and then you'll get the word a quarter later, yeah, this person was diagnosed with a concussion, and they're out. So it's difficult to make these diagnoses. Just understand that for your medical teams as you watch these games.
Joe, I want to take it to the next step, and I don't want you to be specific because, as you mentioned, these games coming up, right? They're NFL playoff games, and you've got NCAA football, semifinal football games coming up, and there's a lot of money tied into the world of football, whether it be playoffs, regular season, big football games, and such. For your medical eye, with the pressure of some of these guys, and whether it be Ohio State, Texas, Notre Dame and stuff, have you watched some of these incidents from afar where you are with your medical knowledge saying, boy, they should test that guy, or I don't know about that guy, but because they're a key player, because some of these other things going on with dollars and stuff, that maybe they're kind of overlooked with a concussion symptom?
Well, I'm not maybe going as far as the way you put it, but I'm saying they'll give them a little bit of leeway or give them space or watch them for a while or have their trainers who know their guys spend more time with them early on. But I really, really have a lot of I just have so much respect for the medical field and the medical teams and the people who go out there on weekends and Sundays and everything like that and give up a lot of their time to be on these medical teams. I really don't think it's the money aspect, but it is a big deal. I mean, is the quarterback an important person? And, of course, the quarterback's an important person. So making those kinds of decisions on anybody, the camera's often focused on the quarterback. So, yes, I look at some of those and I go, uh-oh, in the room, this person's not moving like they normally do. I'd really be keeping a close eye on them. But I really don't believe, I think very far down the list, I really don't think money plays a role in that. And everybody's so aware about trying to prevent this thing, and we've done such a good job. But every time that somebody is the least bit stunned or the old word used to be dinged. We hate that word. Yeah. But when people get hit and it's transient and lasts for a couple plays or something like that, but then you have to have really a close eye on this person. And then we don't know what goes on behind the scenes. They may be taking them in the training room or the blue tent. We don't always see that. But no, I really don't think the money is as big an aspect. The money part is just huge right now. Of course, we see the ratings, like I said earlier, and all this. But I really believe everybody's doing the best they can do. But with this very difficult problem of concussion, it's really hard. And if you assess somebody right off the bat, you may see some symptoms that would clear later. And if you jump right to the diagnosis, so you see what a dilemma it would be, Ray. And I know that people are struggling with it. And yes, a little bit in my heart because I've been on sidelines for 40 years. I do think about it and second guess it a little bit. Okay, now it's time to get a better look at this person. But I really don't believe it's money driven. I really believe in my heart that most people want what's best for these athletes.
Yeah, to Joe's point, if someone comes off with a cranky ankle and they're on the side and you could say questionable coming back, they're able to work it out, blah, 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 and they get back in, let's say in the third quarter. But once you go into the tent, you're diagnosed with a concussion, you are done and no questions about that, and you go into the protocol. So that's where he is going with this whole story. Good stuff, Joe. Thank you. And really, I think that helps us out in looking at the whole situation because these are huge games coming up this weekend and beyond. Thanks for the visit, my friend.
Thanks, Ray. Have a great week.
You too. Dr. Joe Concini, he's the best. Sports Medicine Center, Akron Children's Hospital, part of this morning show, as I mentioned, for over 25 years with us.